Good morning, okay, and 8:34. Happy Monday to you. Feeling a little, got a little tightness in the hip.
Yeah.
I danced a little bit on the stage yesterday.
Oh, you did.
I moved a little bit too much, maybe.
Where'd you dance?
I danced at the town of Huntersville, Halloween in Huntersville. So I'm feeling a little old, Dr. Schmerge. I feel like I need a little care.
And this cold weather sometimes, as you start getting a little advanced in age, you're like, oh, I'm feeling a little stiff. Yeah.
Yes.
Need a little oil in the hip.
There
Is
you
that
go.
something that Equity Health offers? EquityHealthCares.com. Dr. Michelle Schmerge joins us. In-home concierge level care. If I need a little oil in the hip joint, do y'all do that?
We do all those sorts of things. Yeah, we help with all sorts of kind of chronic illness, chronic pain issues, all that stuff.
I imagine as the years go on, share with us some of those stories, because for those that don't know Equity Health, you literally go into people's homes and during arguably for most of them right toward the latter part of life.
For sure. Yeah. So
and you care for them.
we do. So what we do is provide care in home to patients who can no longer really get out to clinics anymore. So people, seniors who are homebound, people who are needing kind of home health services, any of that stuff. We provide the medical level care on top of that.
So medical level care, what does that mean? Like you could do surgery
No.
right in the middle of the living
Hope
room so I don't
not.
have to go?
We do a little bit. So we'll do sort of cyst removal things. We can do like skin tag removals, all that. So minor procedures in your home. I try not to do anything major. I do a lot of joint injections. So for your hip, hip pain. But anything you kind of used to get at a regular clinic, we do in the comfort of your home, because the burden becomes so much to actually get out to a clinic and leave your house. You have to depend on somebody else to drive you, all that.
There's a major generational shift happening right now. So for arguably the most amount of people aging at one time on the planet all together kind of happening right now. So healthcare being a huge conversation. This kind of like longevity wellness conversation, pretty popular right now, it seems like.
It's hugely popular. I was just thinking about the Peter Attia episode on 60 Minutes last night. It's really fascinating, this idea of living longer well. So most people sort of fall off this proverbial cliff at like 75, 80. And so how do we help people live longer better? And so that you don't require a ton of healthcare, any of that stuff.
And that's the preventative side. But for those who, let's say, decided to go with, the extra double cheeseburger along the road of life and lived it to the fullest, some would say, they need someone like you to come into the house and really take care of them. What are some of those services beyond the surgery, right? So practically speaking, who's someone commonly calling you for your concierge services to come into their home?
Typically, it's the adult caregiver. So the person that's like a child who is like 70.
Oh, so it's not the person who needs the help.
No, not typically.
It's the family
It's their 70-year-old child.
Exactly right.
Yes.
Yeah, it's the person who's actually charged with caregiving, and it's their job to get them out to a clinic, which even to get that patient up and dressed takes hours to get them out into the car, to make sure we have a wheelchair, a walker, all that stuff. So we come to you and provide all the services you could need. So any kind of annual wellness visit, any chronic disease management. So if you have some heart disease or some hypertension, high blood pressure, all that kind of stuff that has kind of gotten out of control, we can help manage in the home. And then we do all sorts of what we call acute visits where you're sick. So say you get the flu or COVID or any sort of acute illness, or have an exacerbation, say, of your lung disease, we help all of that in the home.
So for the patients, it really helps to make sure they're getting the actual care without having to wrestle around and get dressed and argue with family, because it's a deep emotional thing. So, and so for the family members to call you, there's got to be some sense of relief when your team shows up, if I had to guess.
Yes, which is incredibly rewarding. So it is so nice to go and be able to help people and see people where they live and help really intervene on that kind of ground level. It's really, really rewarding. It's nice.
So this longevity thing, I would imagine there's some core principles.
Yeah, I want to
in
ask you a little bit more about that, because you mentioned the 60 Minutes episode you were watching last night. What was he saying that the way to longevity is, and kind of how would you approach it?
Yeah, so interestingly, I think he and I prioritize two different things, and he's a little bit older than me, so maybe it's just even a generational change. But obviously there's three sort of core pillars that you need to focus on: sleep, diet, and exercise. He is all in really on exercise and really a significant level of exercise. We've done
like
a lot
CrossFit level.
I think so, but a lot, like 10 hours a week.
Get your 90-year-old grandma out there doing CrossFit. See how that goes.
Yeah. So I think the idea is to start in your like 40s and 50s, maybe even 30s, and then keep that level of training up all the way through advanced age. But I think sleep is incredibly important. So that's where our brain sort of heals itself. It kind of puts everything back together. We're becoming more and more aware that like dementia is something that's acquired, not necessarily inherited mostly. So there's a lot you can do to really prevent cognitive decline. So.
And is the sleep in particular, is that part of the conversation with folks? Do you have that from the concierge service side?
Yeah, for sure. So we actually try to focus on all those things. Dr. Gattia also talks a lot about a lot of protein. So a ton of protein, lifting
I hear
heavy
that around
weights.
across the board right now. Protein is
huge
in.
right
It's
now.
real in. Yeah, it's a lot of protein. So like double the amount you're thinking and eat that much protein, quadruple the amount of exercise you're thinking, all of that stuff. So, but it becomes difficult, the average person, to have that much time in their day to do all those things, to meal plan. If you're not a billionaire, how are you going to have people actually provide those meals for you if it's just you? You have to cook those yourself.
Another big piece is, I would imagine, because every time I go to the doctor, he says, we're getting close. We might want to think about writing that old prescript, having that thing ready in case you need it. And I would imagine there's people that, let's say, forget to refill the little letter jar that has the Monday through Sunday kind of on it there. What's the prescription side like for the services you guys offer? Versus helping to make sure people are taking their medications.
Yeah, we do all that on it. So we see patients monthly. Usually we check pill boxes, make sure that those are all being filled with the appropriate medications. Even if we're changing medicines, we actually have to dig in there and figure out what to remove. And then we send all your prescriptions electronically to your regular pharmacy. A lot of pharmacies locally deliver now, which is terrific. So you can actually get the medication to your home. It's not just Amazon doing that. So we help with all of that. Medication management is probably one of the biggest things we do.
It's complicated, right?
Yes.
And even in like the paperwork side, or you think about insurance, or you think about just paying and all this other kind of stuff. What's the team like at Equity Health? Because obviously, Dr. Schmerge, you're wonderful, but you can't be in more than one place at a time. So what's your team like right now at Equity Health?
We are amazing. I would say I am more impressed with them every single day. Everybody is just terrific. So one of the things that we have prioritized is hiring kind of the best of the best. So we have all of the greatest caregivers that exist out there. We have nurses, nurse practitioners, social worker, really a lot of folks helping us, even some kind of just care coordinators to help answer questions of patients, get them escalated to a higher level of care, and a lot of kind of background work. We do a ton of chronic care management. So how do we kind of manage you behind the scenes, not just on your monthly one visit?
Much like an actual traditional doctor's office when you go to, doc, these people are coming in, they got all these letters after their name, and I don't know all the differences and all that. But there's nurses, there's PAs, there's all this other kind of stuff. Equity Health, how is your team made up right now as far as nurses and versus all of those different positions?
Yeah, so we are nurse practitioner led. Obviously, I'm a nurse practitioner. So I was trained by a couple of incredibly visionary physicians who thought that the future of geriatrics was nursing, that we would actually need a lot more kind of nursing approach to living well, as opposed to kind of traditional medicine of just a different philosophy of care. A lot more focus on kind of quality of life, a lot more technical skills. Can we draw your blood in the home? Can we do all of that stuff? And so that's what we're really focused on, of how to you just don't know. You need a really smart nurse until you do. And it's almost too late. So we're here for you.
And you're constantly looking for those people. What's that like for you in finding that best? Because you want to provide quality service to your patients. So what's that journey like for you?
We do. This has been something that I've really been focused on, is how do we even manifest all the best folks? And it's been happening. So as we kind of grow, I haven't even posted any jobs. I kind of recruit from people that we know, people that the rest of us kind of think are really great clinicians. And then we have a ton of people reaching out. So I get a lot of emails. I have a couple sitting in my inbox right now of, hey, I heard about your team. I heard about this magic that you're creating. How can we be a part of it?
Very cool. Dr. Michelle Schmerge.
Yeah, it's just a different approach than traditional medicine has led us down. So it's a great way to help people age at home and age, comfortably.
Yeah.
Equity Health, equityhealthcares.com. Dr. Schmerge, how does it start? How does the relationship start? If maybe you are that family member that's taking care of somebody in the home and I need help, doc. I need somebody to come in here and help take care of this because grandma won't take her pills anymore and I can't even get her dressed. I don't know where she's even at. She might be down the street. need some help, how does it work?
Yeah, the best thing to do is kind of either Google us or go on the website, call our information. We have 2 main hubs, one here in Charlotte and one in Greensboro. And so just give us a call. We can help you get the care you need. We have one person that kind of handles all of our intake, and she's terrific. So shout out to Lori. So
Gotta need the Loris of the world.
Right?
I know. She's the greatest. So, I mean, we just have just an incredible team. So, but let us know. Give us a call, even if maybe it's not the right time or we can't really offer the service you're requesting. Just we can answer some questions for you and be a help to you.
Dr. Michelle Schmerge, equityhealthcares.com.